Do you have dry eyes or watery eyes and it's driving you crazy and you've done everything you can and really the only solution that you have so far for the dry eyes is eye drops and the wet eyes is Kleenex? Let's talk a little bit about neurophysiology, because in our current healthcare system, we don't ask what's the cause. We generally just treat the symptoms. We don't ask why we have dry eyes or why do we have wet eyes or any of the number 500 different symptoms that are out there that people experience. So there's a little gland called the lacrimal gland. Its job is to produce tears in your eyes, and there's a couple others that we won't discuss, but basically you have glands in your eyes that produce tears, and when everything's working the way they're supposed to, your eyes function the way they're supposed to. If there's something causing that gland not have the ability to produce enough tearing, then you can have dry eyes. But if there's too much function, it can cause wet eyes or too much tearing. So the central nervous system, which is composed of your brain stem, which is the most important structure of the nervous system, it sits inside the top two vertebrae in the neck. And then below the second cervical, you have the spinal cord, which is just a cable that carries all the information out to the rest of the body's tissues, sorry. And then you have 12 cranial nerves, which control different parts of the body, including the eyes, smell, taste, hearing. The glands in the eye are controlled by the cranial nerve, which actually sits inside of the cranial vault, so it's inside of the head. And so we find that an upper neck misalignment can affect any of the cranial nerves, because research many years ago came out and showed even though the nuclei is inside the cranial vault, there are actually synapses that go back down into the brainstem at about the C1, C2 level that then come back up and out. So structural interference at the floor of the skull can not only be at the root cause of dry eyes or too much tearing, it can also be at the root cause of a number of different chronic issues that people deal with, like sinus problems, headaches, cognitive problems, headaches and neck pain, pain between the shoulder blades, low energy, insomnia. And so the upper cervical procedure, which focuses all of its attention on the top two vertebrae and its relationship to the brain stem and spinal cord, its goal isn't to treat any of these symptoms, but rather it's to find out, A, does the patient have a structural problem, and B, if they do, what direction is it off? And we find that out through 3D CBCT imaging, and that allows us to know how you're off, so we then know how to get it corrected. Once it's corrected, pressure's off the cord, central nervous system starts to function better, and often all of the problems that I've mentioned will either improve or resolve as the body returns to normal function.